Hello folks, welcome back. Today we will learn about humerus. Talking about humerus, we will learn about anatomical positions, types and site determination. As you can see in the anatomical position, here you can see I have drawn the diagram. Here you can see I have drawn the diagram. This is the anterior view. Here we have the shoulder joint and here we have the elbow, and this what you can see is the humerus. So talking about its location, it is present between the shoulder joint and the elbow joint here. Humerus is also known as the funny bone. Talking about its type, it is typical long bone. It is developed from the enchondral ossification, that is the hyaline cartilage, and has medullary cavity. Side determination. How will you define if this bone is left or right? This is a typical long bone with two ends. One upper end, this will be lower end, and an intertwining shaft. So talking about the upper end, you can see the upper end has a globular head. This globular head, and it has the lesser tubercle and the greater tubercle and the intertwining sulcus or say bicipital groove. So this should be anterior side like the front side, this like this front side, and this should be medially, and on the posterior side we have olecranon, like that is the back side, we should have olecranon fossa. So that's how you determine. So by determining this, we can see the lesser tubercle is medially and on the anterior side, so this should be the left humerus. Talking about its lower end basically is expanded, as you can see, and flattened. So talking about its like labeling, we can say this which lines the humerus is the medial epicondyle. This one is the lateral epicondyle. The one with the medial epicondyle is called the trochlea, and the other one we here call it as, this one we call it as capitulum. So above trochlea we have conoid fossa, and here we have the radial fossa. And as we said, this is the olecranon fossa. This is the anterior border. Then the one with the humerus is the medial, and the this is lateral border.
So now let's start with the parts of the humerus. The parts of the humerus are divided into three parts: the upper end, the shaft, and the lower end. Starting with the upper end. The upper end is divided into head, two tuberosities, that are the greater tubercle and the lesser tubercle, and two necks. So to start with, the head. The head articulates with the glenoid cavity of the scapula, forming the glenohumeral joint. Then comes the greater tubercle. The greater tubercle lies on the lateral part of the upper end of the humerus, whereas the lesser tubercle lies medially. Then, between these two tubercles, that is the greater tubercle and the lesser tubercle, there is a groove present which is known as the bicipital groove. Then, to talk about the neck, there are two necks of the humerus. That is, first one, that is the anatomical neck, which separates the head from the two tubercles. Then, the surgical neck, which separates the upper end and the shaft. Now, let's talk about the shaft of the humerus. The shaft of the humerus is also called as diaphysis, of which the upper half part is rounded in cross section, whereas the lower half part is triangular in cross section. There are three borders and three surfaces of the shaft. The first border, that is the anterior border, its upper part forms the lateral lip of the bicipital groove. Secondly, about the medial border, it extends from the lesser tuberosity above to the medial epicondyle below. Then comes the lateral border. The lateral border extends from the back of the greater tuberosity below above to the lateral epicondyle below. Then comes the surfaces. First one, that is the anteromedial surface. The anteromedial surface lies between the anterior and the medial border. Then the anterolateral surface. The anterolateral surface lies between the anterior and the lateral borders. Lastly, the posterior surface. The posterior surface lies between the medial and the lateral borders. Lastly, the lower end of the humerus. Lower end of humerus is again divided into three parts: fossas, articular parts, and the epicondyles. Now let's start with the articular parts. The first one, that is trochlea. Trochlea is a pulley-like process covering the anterior, inferior, and posterior parts of the medial articular part of the lower end. This part articulates with the trochlear notch of the ulna. Then comes the capitulum. The capitulum is a small ball like process lying lateral to the trochlea. This part articulates with the upper surface of the head of the radius. Now to talk about the epicondyles. First one is the lateral epicondyle and second one is the medial epicondyle. The lateral epicondyle projects from the lateral side of the lower end and this part is less prominent than the medial epicondyle, whereas the medial epicondyle projects from the medial side of the lower end. This portion is more prominent than the lateral epicondyles. Lastly, the three fossas. First one, that is the coronoid fossa, secondly, the radial fossa, and third, that is the olecranon fossa. To talk about the coronoid fossa is a shallow depression above the trochlea on the anterior surface of the lower end, and this receives the tip of the coronoid process of the ulna when it is fully flexed. Then comes the radial fossa. The radial fossa is a very shallow depression on the anterior surface of the lower end above. It receives the margin of the head of the radius in full flexion of elbow. Lastly, about the olecranon fossa. Olecranon fossa is a deep depression on the posterior surface of the lower end just above the trochlea and it lodges the olecranon fossa of the ulna when the elbow is fully extended.
Hello folks, talking about the hand bones, basically hand bones, as you can see in my notes too, we have carpals, so carpals, metacarpals and phalanges. Starting the segment with the carpal bones, we have a mnemonic that a she looks too pretty, try to catch her. So for S we have scaphoid, lunate, then we have triquetral, pisiform, then we have trapezium, trapezoid, capitate, hamate. So these are the 8 bones of the carpals. Talking about is ossification, they are all cartilaginous at birth, then they ossify by one center. Well, capitate is the first bone to ossify, whereas the pisiform is the last bone to ossify. Talking about the scaphoid fracture. Now scaphoid fracture, you can see in your anatomical snuff box, you can see that it is present there clinically, to be honest. So scaphoid fracture is the most common fracture from the carpal bones. It occurs when you fall on your outstretched hand and this area is getting damaged. So what can happen due to this is, first of all, you have a fracture and the second is a vascular necrosis. Well, you have basically all your we can say blood supply vessels passes from the distal to the proximal part. So this distal to the proximal part gets damaged, due to which the blood supply to the proximal is low, because some blood supply even occur from the proximal to distal, but majorly it is from distal to proximal. So there is low blood supply or no blood supply to the proximal.
Which is metacarpals, well, they are small, long bones. They have three parts: head, base, and shaft. Talking about their peculiarities, well, let's talk about the first bone that is, first metacarpal bone. Well, it is shortest and stouts meant fat, rotated medially through 90 degree. Therefore, the dorsal surface faces laterally. Talking about its base, as you can see, it is a concavo-convex shape, that is the saddle shape. Well, it articulates with trapezium, then epiphysis at proximal end. Talking about ossification of metacarpals, they have two centers of ossification. Primary center is shaft, secondary center is head, but not for all. Well, for the first metacarpal, the secondary center is base. Well, let's talk about the clinical correlation. We have Bennett's fracture. Well, it is oblique fracture of base of first metacarpal. Coming to our next segment, which is phalanges. Well, phalanges are two in thumb, as you can see, and three in other four fingers here. It is the short long bone. It also has three parts, that is base, head, and shaft. Base can, you can say it as proximal end. Here we can say it is as distal end, head. Ossification centers, two, that is primary is shaft and secondary is base. That's all you have to learn about the hand bones.